First time I remember ever being fascinated by research is thanks to my father, actually. He is a jurist and also a researcher, so I remember when I was a kid, we would go together to the libraries and I would go through the searching with him and those databases that existed, at the time. I'm a lawyer by training. I always knew that I wanted to do something that looks at both law and medicine more generally. My name is Zawati. I'm an associate professor at the Department of Human Genetics at the Faculty of Medicine and Health Sciences, and I'm also a research director of the Center of Genomics and Policy, also at McGill. In terms of challenge, and this is what I'm really passionate about, is we're here interested in the social, ethical, legal considerations of using artificial intelligence for genomic biomarker identification. And just to contextualize, when we talk about biomarkers, we're talking about the biological indicators of the presence or status of a disease. So here we're really prioritizing the pressing equity, diversity, and inclusion considerations and issues that are raised by the use of AI models, including machine and deep learning algorithms. And this particular use of such tools or such technologies, if it's not done responsibly, may worsen inequities. And algorithms that are trained on biased or unrepresentative data may actually further the risk of discrimination. We will be doing focus groups with equity-seeking populations to better understand their perception of the use of this technology, but also their level of trust in this technology. First, this project will help ensure that the benefits of RNA-based precision medicine therapeutics are fully realized and equitably distributed. Right? So this is really at the heart of our research project. Secondly, this project will also help cement the D2R's program as a hub of research excellence and responsible innovation in the development of genomic-based RNA therapies. What's really important is to look at science in a very holistic way. And looking at the ethical, legal, and policy issues is really at the heart of that. And in a way that allows us to anticipate those issues, work on addressing them in order to ensure that the road for that innovation is actually paved very solidly. There is beauty in interdisciplinarity. There is really a richness when you have a scientist, a researcher, a clinician, an ethicist, a lawyer, patient, partner, member of the community working together towards a common goal. And I think this embodies what D2R is about, and this embodies what our research is about. Our project will really, again, be the first of its kind to provide a guidance document and peer-reviewed outputs on the ethical, legal, and policy good practices for AI-driven genomic biomarker identification. And this, I think, will solidify D2R's status as a leader in the development of inclusive genomic-based RNA medicine.